Hello, everyone, and welcome to Atlantic Coast Aesthetics. I'm Matt, your live streaming host, and with us is Dr. Thomas Payne. Dr. Payne, 2024 has been a busy, busy year. We get a question every once in a while. Where can I find Dr. Payne? And yeah, I know you're a busy surgeon, and let's tell the folks on where to find you and what's the latest news.
Yeah, I mean, it's a good question because we are on social media, Instagram, Dr. Thomas Payne, and the practice is kind of an interesting hybrid. I do a lot of work in Palm Beach Gardens at my own office, where I do some, surgical consultations, small office procedures, and then things like Botox and injectables, where I actually do a fair bit of that. And those are, in that practice. I also have privileges at local area ambulatory surgery centers. So we have about 4 or 5 locations between Jupiter and down to actually Hollywood, which are getting into Broward County. So a couple in Palm Beach County and then down in Broward County. Then I also work at Unique Aesthetic Center in Miami. And I'm one of two surgeons there at a practice where I work there as an independent contractor. That practice um, basically will offer is office-based surgery. So I can't do some of the things that I do at the ambulatory surgery centers because for patients that have either a larger BMI or particular medical problems, you can't have surgery in an office-based setting. So without getting into all the regulatory details. So those patients will often come to me through my private Palm Beach Gardens practice, and then we will do the surgery at one of the local ambulatory surgery centers. I also have hospital privileges at a location in Miami and in Coral Springs. So for the hospital level setting, essentially you can do surgery on patients that are either ASC candidates or if they have, even other issues where the ambulatory surgery center doesn't want to do that procedure, that can be done at the hospital. So it's a little confusing, but the basic thing is just find us either through the website or Instagram, and we will get you to the right location. Um, the Miami location is one of the Miami surgical clinics, and I work there for basically it's been several years with a collaboration because the centers for people that kind of follow the Miami plastic surgery scene a little bit, sometimes they've got little issues where things have shown up in the media and news and things. Most of those situations that show up there are actually preventable and they don't happen when you have the right people doing the surgeries. So that's kind of how I got involved there. If you look myself and my associate at Unique, we have a strong safety record in many, many thousands of procedures, both with BBLs, combo procedures, tummy tucks, and then we often will take a look at people that may have, medical issues or higher BMI or something kind of that's not perfect, and they may get, turned down. Actually, I prefer if people come to me after having been turned down elsewhere rather than having the surgery elsewhere and ending up in the newspaper. Because a lot of times with those problem cases, when I read about them, it's not surprising why something went wrong. It's usually one of two things. One is somebody that's doing plastic surgery that's not trained as a plastic surgeon and may not be familiar with the particulars of how to do this without getting into trouble. Now, there are people that aren't plastic surgeons that do reasonably good work and do okay, and I don't have a problem with that. But when somebody does something that they shouldn't be doing and you see it in the news, it's like, okay, well, that's not a surprise that this went wrong. The problem is then it reflects on the whole field as if it's dangerous or unsafe, and that's unnecessary and doesn't really have to happen. So rather than somebody that has a medical problem, I would rather not see them have surgery and, you know, lesser hands, so to speak. I'd rather have it done by a plastic surgeon. If it's me, that's great. If it's another quality plastic surgeon, that's great too. As long as we get the surgery done without problems, I prefer to see that. So that's why I don't mind taking a look at those cases. There are some people that shouldn't have surgery, cosmetic plastic surgery by anybody, even in a hospital setting. Those are fairly rare, but there are people that have either severe medical problems that are not controlled, or they have conditions that require the use of blood thinners and they cannot stop blood thinners. Those patients really aren't great candidates for cosmetic surgery. In some cases, those medical problems may be optimizable, and we can get them seen by the relevant specialists, get them fixed, tuned up, and in a condition where they can safely undergo plastic surgery. And a lot of surgeons will turn those people down because they're not easy. We'll take a look at them, and we've had a long record of getting people through the surgeries, no problem, with good results when those prep steps are taken. And then there are patients that they may take blood thinners for reasons that aren't real severe. And with consultation with the doctor that prescribes that, there may be ways that, we can get to a window where they can come off, have the surgery, and then go back on. And I haven't had any big issues with patients like that. Again, it's about selection and optimization, and then doing things in a controlled fashion so that we get good results without problems. So that's the basic philosophy of the practice overall. We certainly like to do the so-called straightforward and, uncomplicated procedures, but we're willing to take a look at, just about anything. And then sometimes if there's something that is really involved and involves like multiple steps, and it might be more of a hospital reconstructive thing, we can even refer people to practices that tend to specialize in that, because we do more outpatient work. The more involved multi-step reconstructive things, I'm capable of doing those, but we haven't crafted the practice around that kind of setting. So I don't tend to take those on because I want to make sure I can see somebody through the surgical phase of the care all the way. So if I'm not sure I can do that, then I don't want to take that case on, but we would talk to you about it and see.
Thank you, Dr. Payne. And with 2024 almost halfway done, and with summer just literally right around the corner, what plastic surgery trends have you been performing and seeing that you can share with us today?
Well, there's the usual standbys of tummy tucks, breast surgeries, and liposuction. BBLs are still popular. And like, again, I will often see people with BBLs that may have, they might have, maybe it's been done once, maybe they didn't like the result, maybe they want to do a second round. A lot of times those get turned down by many of the BBL surgeons. We take a look at them. There are even a special category of people that have had substances injected into the buttocks. Oftentimes this is done outside the US, or if it's done in the US, it's done kind of illicitly. Those tend to get routine turn downs, especially for the Miami clinics. It's kind of a policy. But I'll take a look at those people through the other practice, because depending on what was done and what the tissue looks like, it may be very reasonable to do a standard BBL on top of the substances that have been placed. But those are kind of individual cases because it changes. So we do that. The mommy makeovers, very common, like usual. And then another one that is increasing in popularity is the breast implant removal and breast lift procedure. Oftentimes they go together, because if you've had a breast implant for a period of time, the tissue tends to be stretched. And if you remove the implant without doing something to the tissue, then oftentimes the breast is flat and the shape isn't real good. Now, it's tricky because there are some surgeons that promote the implant removal maybe a little more than is supported by the science. So when patients are having symptoms, systemic symptoms of different illnesses, they can possibly be related to the implants. That's an ongoing area of scientific investigation. But symptoms by themselves are real. Whether or not they're connected to the implant, we don't necessarily know. But we are happy to remove the implants for patients that are not comfortable having them and feel that they might be contributing to some sort of systemic disease or generalized symptoms. However, in those cases, I usually like to evaluate the patient fairly closely, because here's the thing I worry about. If someone comes in and has symptoms, and that could be indicated of a different cause, and removing the implants may not affect that cause. So we want to make sure we know what the diagnosis is, and if we don't have something else, then we proceed with the implant removal. But I would not want to do the implant removal and then miss another diagnosis, if that makes sense. So I always look at those folks carefully to make sure we have a plan, and then tailor the surgical intervention around that plan so that we get them better. Now, the good thing is, even though there hasn't been definite laboratory linked findings as of yet. Although it's still an area of ongoing study. A lot of patients will feel better with the subjective symptoms when we remove the implants, even if I can't put my hand on a lab finding. So that's a positive thing. So we do, again, we offer that. We would rather do it because implant removal, especially if there's a removal of the capsules and things, that can actually have a little more complications than people might think. It's a little trickier than just taking an implant out and, doing some simple thing. So again, we'd rather handle that so that we get the procedure done safely. So again, it doesn't reflect, negatively on the profession overall or the particular procedures.
Well, thank you, Dr. Payne. And if you have a question for the doctor, please visit Instagram, Facebook, YouTube, or the website. All those links will be below in the description. And Dr. Payne, I think you had the barcode or
Yes, actually, right
yes,
over here. I
there we go.
go this up here. This
There you
is
go.
let me see if I get it to focus. That's
Yep,
the
there's a QR code,
Instagram
and go ahead and take a picture of
QR
that
code.
or scan it, and you'll
Yep,
find the Instagram site right away.
great. All
All
right.
right, Dr. Payne, we'll see you on the next one, and thank you for your